living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
In many rural communities, there simply aren't enough specialists to treat everyone who needs care. This is especially the case for people needing access to specialty care for their complex health conditions. My guest today will talk about a project underway in Montana and Wyoming that focuses on spreading knowledge and building care capacity in rural and underserved areas. Welcome to Healthy Living for Life. I'm Sarah Medley, your host. Welcome back. I'd like to introduce my guests, Dr. Christine McKibben, Associate Professor at the University of Wyoming and Director of the Wyoming Center on Aging, and Kevin Franke, ECHO Project Coordinator with Mountain Pacific Quality Health. Both will be talking about a special project, Project ECHO. Welcome to our show, both of you.
Thank you, Sarah.
So I'm going to start with you, Christine.
Sure.
You're with the University of Wyoming.
Mm-hmm.
Can you talk to our viewers about Project ECHO and the University of Wyoming, and what's your role?
Absolutely. Project ECHO, which stands for Extension for Community Healthcare Outcomes, is really an innovative continuing education and guided practice model that's really appropriate for a variety of providers throughout the healthcare system. So the goal of Project ECHO is to enhance the capacity of the workforce to deliver best practice care and reduce health disparities. So reducing disparities, for example, between urban and rural areas, say for a particular disease like diabetes. So at the heart of the ECHO model is a hub and spoke information sharing network. So if you think of it like a wheel, where you have a hub, which is an expert team, interprofessional expert team with a variety of providers who have the best evidence-based knowledge in, say, management of diabetes. And then that radiates out through a multi-point video conference to spoke sites, which may be practices or providers across health professions in rural communities. So the idea with the ECHO program is really to support these community providers in delivering best practice specialty care in areas where specialty care services may not be available. So my role is really an administrative one. So my role is largely to manage a team of faculty and staff that coordinate all aspects of the ECHO program. And we do anything from scheduling the ECHO program, recruiting the expert team members, to helping to recruit the spoke sites, providing technical assistance so that the providers' continuing education experience and guided practice experience is a smooth one.
How did Project ECHO get started?
Well, this is interesting. Really, it was born out of need. And so we saw that it was developed in the University of New Mexico Health Sciences Center by Dr. Sanjeev Arora. So Dr. Arora is a liver disease specialist with particular expertise in management of hepatitis C. At the time, in New Mexico, there were 2 clinics that were available with high level of expertise in treatment of hepatitis C. So you can imagine that the wait times were very long to see Dr. Arora, and those clinics are located in more urban areas, and there was just really a lack of specialty care in rural areas. So people had to travel many miles and wait long time for the opportunity to see Dr. Arora. So he felt fairly frustrated by this lack of specialty care in those rural areas, and people were coming to see him maybe later in the disease process than maybe would have been ideal for their health outcome. So Dr. Arora developed this Project ECHO, enrolled rural primary care providers in this program, and then co-managed hepatitis C with these providers through this information sharing network through video conferencing. Excitingly, in 2011, they found and published a paper in the New England Journal of Medicine about their findings that the care was really equivalent. So care that was provided in these rural areas by the primary care providers trained through ECHO was equivalent to that provided in the academic medical center. So with those spectacular findings, they wanted to expand the ECHO program. And in order to do that, they needed help to do that. So they developed a concept called the Super Hub. And the Super Hub is a center with extensive replication experience in the ECHO program, and that has a strong relationship with the original University of New Mexico team. And they are certified to provide additional training to other groups that want to implement a similar program, like, or actually ECHO program. So with that, the University of Wyoming, with their extensive experience in delivering the ECHO program, became a super hub and was certified to do so, and that was done in 2015. So the Center on Aging also delivers ECHO throughout Wyoming, and our particular role in the Center on Aging is really to improve evidence-based practice delivery in geriatrics across Wyoming, and so that's how we became involved.
So Kevin, can you talk briefly about Project ECHO in Montana and Wyoming?
Well, thank you, Sarah. Just like Christine said, it was born out of a need. The Mountain Pacific's work with our care coordination and our work with our providers throughout the states of Montana and Wyoming, we were working one-on-one with individual communities and working on the transitions care and the care coordination, which I'll talk about in just a little bit more depth. So bottom line is that we saw a need for the rural and the more frontier areas that we were not reaching at this point, and our partnership with the University of Wyoming was a perfect opportunity to do that.
Telehealth and telemedicine are widely used across the country. Stay tuned to learn the difference between Project ECHO and telehealth.